So it is officially 4:01. So I'm gonna do just a little intro stuff and then we'll jump on in. So we are going to take a look today at comprehensive educational evaluations. So one big question that I have for all of you is how will you know that today is successful? Like, what is going to make it successful? What questions do you maybe have that you want answered? What areas do you really want or hope that this training hits on so that I can be sure that I'm getting everything that you guys are needing? But also, if there are some topics that you need covered that aren't covered or we don't go into detail enough, I'm happy to talk with you a little bit more about it. We can schedule an additional training if you think that your team members would benefit from some additional time or maybe just the ability to ask some more individualized questions. So if you want to throw anything in the chat that would tell me a little bit about that, I would be happy to see that. Again, I understand some of you may not actually be able to access the chat, like if you're driving or something like that. So don't put your life at risk or anything like that. You can put in anything into the chat as we go through this. I also am great if you have a question, if you unmute or if you like to raise your hand. And I'm not, however you like to do this, I want to make this as much back and forth conversation as we possibly can. So I see Sarah put something in the chat, so I just want to read that really fast. Okay, Sarah, read your comment, and I am right there with you. I have so many questions, and to my knowledge, the Senate did not vote on that today. If someone else knows the answer to that, feel free to throw that in the chat. But to my knowledge, things have not been voted on. So I see a comment about systematic observations. I can assure you we are going to touch on systematic observations today. So please ask questions when we get into that section. If there's something that I do not clarify very well for you, I will be 100% honest with you. If you have a question that I don't feel like I can answer, I will just be honest with you and tell you that I'll get back with you. Hopefully I can answer most of your questions. Writing legally defensible reports, for sure. And we'll talk about, we won't directly talk about that, but we are going to talk about just being sure that we're individualizing an education evaluation. So we'll talk about some precautions that we can take into that. And then at the end, we will have some time for questions. So feel free to ask your questions at that time too. And then FBAs for depression with no behavior problems. Tammy, I would love to talk a little bit more about that. So that might be something that we can mention at the end of this training or when we have time for those questions and other comments. So if this is your first training with the IEP Technical Assistance Center, I just want to say welcome and thank you for choosing to spend your afternoon, at least this hour and a half with me. The purpose of our center is really just to help increase knowledge, skills, and capacity of Indiana educators to improve outcomes for students with disabilities. So we promote education with a belief in shared responsibility and access to that really strong core curriculum with high quality instruction that benefits all students. And as it pertains to what we're talking about today, we're really talking about those assessment strategies, timelines, and we're gonna look a lot at indicator 11. So I will not talk a lot about myself because nobody really wants to hear that. I'm a super boring person, but I just want to give you a little bit of background so that you know where I'm coming from throughout this training. I am a school psychologist and I've worked with some districts in central Indiana. And so I do have that background of school psychology like many of you do. So I taught middle school English for 18 years before I came to the center, and I got my degree in school psychology. So that's just a little bit. I like you to know that about me. That way, you know where I'm coming from and what my frame of reference is as we go through this training presentation. So we're really going to take a look at indicator 11. We're going to look at some of those requirements and timelines associated with staying compliant within indicator 11, but we'll also talk about some general things to keep in mind when it comes to just overall compliant evaluations. We're also going to look at just the principles of comprehensive evaluations and the importance of really assessing every area of a suspected disability. And then really, as we go throughout the whole training today, we're going to look for those strategies that we're ensuring that individualized assessment practice so that, you know, when we are looking at each student, we are looking at them as one student, right? It's not, we're not basing it based on, you know, oh, so this student fits into this bubble. So because I do this for all kids, this is what I'm doing for this child. So really wanting to try to focus on keeping the our evaluations and our practices with the individual student in mind. And Rebecca, I see best practices in SLD identification. We're going to talk a little bit about those. So as we go throughout, if I don't make something very clear, please, please, please feel free to throw something in the chat, unmute. Again, whatever is easiest for you guys to be able to communicate through this training. So the first thing I want to do is just take a look at indicator 11 and what it says. So indicator 11 is going to be a child find issue. And if we look at our compliance guidance document from the Indiana Department of Education, we know that indicator 11 speaks to the percentage of children evaluated within that 50 instructional days of parental consent or when an expedited evaluation is required by discipline procedures. And I put, you know, where we can find those discipline procedures in Article 7. So if you have any questions about that, I wanted to be sure to put that in there for your reference. And like I said, as we go through this, if you have questions, do not hesitate to reach out and ask. So again, we're really looking at keeping those timelines within that 50 instructional day count, or if we're looking at an expedited eval and why we would need to have that. So as we think about the timeline piece, we know that for an initial evaluation, Article 7 is going to require that we have the evaluation completed and that we have the case conference convened within 50 instructional days of the date that we receive parent consent. So it's the day that someone from the school receives that signed consent, our timeline starts. Sometimes parents might email that. Sometimes they might sign and return the hard copy. So it's important that we track, you know, how we're getting these permissions back because that is going to start our 50-day notice. And just because a parent, you know, dates it for a certain date, that date is really irrelevant. It's a matter of when we received it. And just as good practice, I always encourage psychs or whoever is responsible for taking in that that signature, that you go ahead and upload that into IIEP. And I know that we're getting, you know, our new system with PowerSchool next year. I have no idea how that's going to work at all. So when I talk through things today, I'm going to hope that things with PowerSchool are somewhat similar just in what we can upload and all of that stuff. But when we upload that documentation, it's great because it's saying, you know, that, hey, I know this is an important enough document to put in here. But then if our director were to get a call or a question about parental consent, they can go into the system, they can pull up that parental consent and see that it was signed. So it's just good for procedural information and policies to go ahead and upload that documentation into IIEP. So when we think about that 50 instructional day timeline, we do have 4 exceptions that are outlined within Article 7. So I want to talk about each of those different exceptions that we might encounter. So the first one is related to keep clicking. I'm just a clicker, I guess. When we have a kiddo who is getting ready to turn 3 years old. So when we have a child who is transitioning from that early intervention to early childhood special education, so going from like first steps into like the public school pre-K environment, then we have to have that evaluation completed. And we have to have the case conference convened by that kiddo's 3rd birthday. So that is a big, when we think about how to ensure that, thinking about our communication that we have with those programs who our students will be transitioning from and into us, so that we know that we are for sure addressing those kiddos' needs by the time they turn 3. So that we have a plan in place for when they come to us. And then if you can't see the chat, I just want to share with you. So Maggie Hampton is on this training, and Maggie works for the Indiana Department of Education. So she just wants to let us know that users will be able to upload documents into the new system pretty easily. So that's exciting to hear. Thank you for that piece of information, Maggie. And she said that she's been through some training. Oh, awesome. So she can help with questions on that bit. So I am very excited to hear that Maggie can answer those questions for us.
I'm no expert, but I will do my very best. It is, though, I will say, a very user-friendly system. So if you have not done the training, don't be nervous. It's a pretty user-friendly system, especially compared to what we do now with our current system. So I hope it's a breath of fresh air once you guys get in there and start using it.
That's exciting. Thanks, Maggie. So the second exception to that 50-day timeline is when the parent of a student repeatedly fails to or refuses to produce the student for evaluation, then the timeline may not be met. So this could be a situation of excessive absences, or if the student is in like a homebound placement or something of that nature, and the parent isn't bringing the child in. So in these cases, documenting every single communication with the parent is, of course, going to be in our best interest, and really entering that even into the system, just so that we have all of the communication documented in there. And then I don't know about you guys, but I know I always would like to keep my own personal documentation as well, maybe in just like a communications notebook or something, just so that I had it handy, because sometimes I would get so many kids, I would get them confused or mix them up. And so I know that when I had those notes handy, it was super beneficial as well. And if you have questions on these exceptions, again, throw them into the chat. So the third exception is really about when we have a student who is in the process of an evaluation and moves to a different district. So when we have that situation that occurs, that 50-day timeline can for sure be adjusted. We just have to be sure that we are communicating with parents to agree on a new timeline So when that student enrolls in a school or another public agency after that consent has been received, but it has not been conferenced on, then the incoming school, of course, must ensure that that evaluation is completed. And we have the word promptly or prompt, that it's a prompt completion. So that's going to look different in every case. And so we have to take that again by an individualized basis. We might have an idea that we would like to have it done within a certain time frame. But really the students' needs and our availability of resources will dictate that to some degree. So it just needs to be sure that you have talked with parents and that you've both agreed on a new timeline. And then the fourth exception is when a child is in an evaluation or an evaluation has been requested, and the student is subjected to suspension, expulsion, or placement in an interim alternative educational setting. That's when we have the expedited evaluation, and we have to have it within 20 days. So that is really the only time now that we have where we have to have that 20-day eval. So again, throw questions in the chat if you have them. When we think about our reevaluation timelines, we have three different areas here. Okay, so Rebecca has a question. Let's go ahead and answer that. Her question, does this count for one suspension or enough to reach a manifestation? So let me go back to that. Okay, so I'm going to tell you what I think the answer is. And then if someone else for sure knows, please feel free to chime in. And I will for sure get clarification on this. So I'm not telling you the wrong thing. But my understanding is that when the suspension leads to removal from the general education placement or the placement that they're normally in. So I don't believe it's just like one suspension, but yes. So Sarah threw in, so if going on homebound, yes, that would be an exception. And if someone else has another, example, throw that in there, please. I've just never read it and interpreted it as that single suspension. And I've not been in a district that I guess really where that had occurred.
So, I work in a high school setting, and I feel like this happens a lot where we'll have students that get suspended enough days or whatever, get suspended for something really big, like threatening to shoot up the school. And then they are placed on homebound in the interim time, and it's post that placement that they request testing. And I think that a lot of the time it's parents trying to be like, well, they have this. And that's only for initials, correct? That it would be expedited. So if it's a reeval, we put it on a 50-day, that's still within compliance, but they ask for a reevaluation because they're like, well, he's up for expulsion or suspension right now. So then they want it. Okay. I was just kind of wanting a little clarification on that because this comes up for us,
Yeah,
for me a
and
lot.
I'm actually going to write that down to make sure that I tell you the right thing, but we're actually going to talk about reeval timelines
Yeah.
here next.
Okay. But if it's requested for that initial evaluation post them getting in trouble or as a result of them getting in trouble and the placement being switched,
Yes, then we have
then
to do it in that
it would be
20.
expedited. Okay.
Yeah.
Thank you.
So when we look at the reevaluation timeline, and so this is when we get, in the system and we get those three different areas where we can check. So we want to reestablish eligibility if we're just looking to like update scores and you know, we know that a student is maybe qualifying under the eligibility of ASD and we're going to keep that. We just want to update things. Then we can have that by the next ACR. Um, and yes, to answer your question, Rebecca, I think we got that answered, but if we didn't, please let me know. And I'm trying to man the chat and do this, so I apologize if I have to stop and read and all of that. So we have got that reestablishing eligibility, and my computer just looks like it's gonna shut down. Hopefully that's not the case. So we've got a full year for that. So we want to do that by the next ACR. And sometimes I've seen this want to happen like when we are just, you know, a kiddo maybe went through the initial evaluation in like first or second grade, and here we are fifth and sixth grade, and we just need to update things. We just need to reestablish that yes, they are still eligible. So that would be a great case of why we would need to do it. Also, if we have students transitioning into high school and we want to get some updated scores to reestablish eligibility for placement in high school courses and that sort of thing, we might need to do that as well. Okay. So I just had to escape that for a second. My computer is plugged in and it's telling me that it's not charging and that I have 18 minutes of battery left. So gotta love those problems. Okay, I think we're going now. I'm so sorry about that. All right, so that's our first box. The second box is to determine eligibility for special education or a related service under a different eligibility or an additional eligibility. And so, Sarah, this is where I want just a little bit of clarification, because when I heard you ask your question, the way I interpreted it was the child is, say, eligible under specific learning disability, but parent is requesting an emotional disability evaluation. Is that what you were? Okay.
Yeah, and it's the result of a suspension or like pending expulsion, but normally, yes, it would be put on the 50-day. And so I just wanted to make sure that we were like doing that part right, because they're not initials, they're reevals where they're seeking that different eligibility area. Usually it doesn't make a difference anyway, because preemptive, but they still like seek that out. So I just want to make sure that those didn't have to be expedited, because I do remember that coming up one time with my admin, like wondering if it should be expedited, and I didn't know, like, I just wanted clarification on how we were interpreting it to make sure we were doing it right.
Right. And I know it's in Article 7 somewhere, and we can pull it up later and take a look. But, you know, even the system, as I think about how it's set up, we couldn't even force a reeval under that 20 days.
To be expedited, right.
Yeah.
Yeah. I think that that's kind of where we ended up landing on it.
Gotcha.
Because I think sometimes in those situations, you know, parents want it done right away or the school wants it done right away, but I'm swamped and I'm like, well, like I can't. So yeah.
Understand. So then the other option we have for a reevaluation is just something to inform the case conference committee of the student's needs. So it might be like assistive technology or a related service. Maybe it's an FBA. The districts I've been in, that's where we always put that as well. All right, so if we don't have any questions over that, we can go into just the evaluation procedures. So as we think about this part of evaluation procedures, this is really more of like that pre-referral. So where we're putting together a team, we're getting ready to review data, that sort of thing. I always think it's great policy that your district has something in writing that establishes your evaluation procedures. And that way you can be sure that you are being consistent with every single student. When you think about that referral process, we're not doing something different because this child exhibits a, this quality or because the parent's child works in the school. But really, we have those very consistent processes that we're following, but it also makes things efficient. So if we know that we're working, through things in a certain order, or we need to do X, Y, and Z, it really just creates that sense of efficiency for our team. So this next bullet point, we're going to talk a little bit more about later on when we talk about defining the roles of the multidisciplinary team members. But Article 7 lays out what each of those roles will be. So we'll get into that. But it's always nice for your teachers to also know just what their roles are. I know especially from like working in an elementary has been different from like, say, a middle school. But sometimes middle and high school gen ed teachers sometimes forget, that they can be part of that multidisciplinary team and that we really need their input and value their input. And so clearly defining that role at the beginning of each year is really beneficial. And I don't know about you guys, but I always find it so helpful when the administrators support the gen ed teacher, fully being a member of that M team and helping them to see that they really do contribute a lot of valuable information to the team. And then really, how are we involving parents in the procedure? Are we providing them with the information that we need to? Are we giving them that notice of procedural safeguards, the consent? Are they receiving it in their language so that they can understand it? All right, so when we get that M team together, and one of the first things that we really want to do is review that existing data. So hopefully you guys have some good systems for that. And this is an area where we could potentially look at some more training if your teams needed some of this, but just about how to review that data and what types of data we can look at to collect. So whenever we meet on a student, we can ahead of time, we don't have to have permission to pull all sorts of data that we can. So when you think about what sorts of data you might want to discuss, just to try to get some engagement, throw some ideas in the chat of what sort of pre-referral data we might be able to look at as we review some of this existing data. But it's really important that we do that. It's going to be helpful for a lot of different reasons. I was going to wait to see if we had anything thrown in the chat before I started saying anything. So really, when we collect that data, we've got some things, some standard test scores for sure. COGAT, iRead, attendance, nurse visits, teacher concerns. Yes, love all that. Grades, we can look at, if we're in elementary, we've got ORF scores, we've got iLearn scores, iReady, interventions, yes, discipline referrals. Yes, you guys are like hitting them all. Awesome. And thank you for participating. But these can be done because then they can really help guide where we think the rest of the evaluation or the potential for an evaluation may need to go, because it's going to help us determine what eligibility area, we might be looking at for a student, or it helps us to rule out a certain eligibility area. But it really also will help us as we look at any exclusionary factors. So we know that, and we'll get into this later, but when it comes to specific learning disability, there are several exclusionary factors for that eligibility. So if we're seeing early on that a student hasn't had access to the curriculum or hasn't, then we're going to be able to say, not really sure we can go through with this. We can do other things, but maybe we just don't need to go right into that evaluation yet. But then we also know what data we've already collected. So it's going to save us some work when we get to the evaluation, hopefully, because we're going to have that data already and we're already going to be looking at it and interpreting it, and being able to apply it to our evaluation. We can also get some great considerations, the need for an interpreter, if we're going to need that with our student, because we want to be sure we've got to assess them in their native language. But we might also need to look at, do we need to get some permissions and releases to get information from other providers, from a mental health provider or another doctor? Or maybe an outside evaluation has been completed and we want to be sure to get access to that. And then Emily threw in WIDA scores. Yes, those are very important for our English language learners for sure, as part of that pre-referral. Just figuring out where they are. And I know one thing I always like to look at, and you guys throw things in too, when I look at those WIDA scores, is I'm really examining, are they improving or are they kind of staying the same? Because that gives us a lot of insight into where our kiddos might be as well. All right, so when we think about that pre-referral data, we really want to try to get the highest quality of pre-referral data that we can. It's just going to add so much more validity to what we're trying to do when that is quality data. So it helps us just to stay compliant and not have those inappropriate referrals. So we don't want to find out, 20 days into our evaluation that the student missed the whole prior year, wasn't enrolled anywhere. So it helps us to keep our caseloads more manageable. It kind of helps us to stay a little sane as well. Getting not so great pre-referral data and then getting into the evaluation, and you just want to pull your hair out sometimes. The better data, the better referral question that we can have when we're asking if a student will qualify for a specific area. And again, like I mentioned on the previous slide, some of the information we collect might satisfy a piece of the evaluation requirement. If we're looking at SLD, we should be looking at all of that Tier 3 RTI data. We know that that's a necessary component of that SLD evaluation. So let's really look at it and examine it. See, is it being done with fidelity? Is the data being tracked and recorded? Do we have usable information based on the data that we are given, the benchmark scores that we have, and so on? And I know sometimes when we look at, and I'm not sure, I know a few of you mentioned that you're high school, but one thing that I ran into was, we've got this kid in middle school and we're going to look at specific learning disability, and the child has never qualified for anything. And it's thinking, okay, well, what information do I use at the middle school level? Because middle schools tend not to collect that benchmark data like elementary schools do. I feel like they, for the most part, are so good about writing an RTI plan and implementing that and tracking the data. Whereas with middle school, that doesn't really happen as much. So I would love if some of you are middle school and high school and you have some feedback. This just helps me as I go into other districts and talk to them. How have you found that you get the best information about like the interventions and strategies that have been tried as you go into those evaluations? And if you came with that question today, I'm afraid I'm not going to be able to answer it very well, but that's why I kind of threw it back to you guys. I'm curious to see if there are some really great strategies out there that any districts have come up with to collect that specific data. So when we look at the multidisciplinary team members who are required, we kind of have this broken down into just each eligibility area at the top, and then the member is going down the side on the left, and then who is required for that as part of that multidisciplinary team. So these are the people who are the non-negotiables, and this is the bare minimum of who needs to be involved in those evaluations. I do have this slide created as a really nice handout. So it's just a one-pager. So if you have like anyone in your school life who you think might benefit from something concise like this, shoot me an email. I'll give you all my contact information at the end, and I'd be happy to share this with you. I just really like this. It's a great handy dandy tool, can be put into like a binder. If you guys are anything like me, I have like my Bible, my school psychologist Bible, where I put information about the CLIM, and I put things like this and score reports and copies of different subtests that make up my whole battery and all of that. I always have that handy. Even now, I keep it because you never know when you might need it. But this is just a great little handout to show who is required. And even for special education teachers, I think this is a really beneficial document for you guys to have as well. When you are creating your notices and you're questioning, who do exactly I need to include in this evaluation. I'm doing an autism evaluation. Do I need the gen ed teacher? Well, according to, legally, no. However, best practices, probably. I would for sure want them as part of the M team if the student is in those general education classes. So we here, like I said, are the required members, but then we have those other people who may be important and be able to give us some really great information on the student, because we want to keep this individualized. We don't want to say, well, we only have these people when we're looking at this eligibility category, and that's just the way we do it. It's a fill in the blank, name of the school thing. Well, it shouldn't be a thing. It should be a student, case by case. It's individualized for that student. Who else might need to be involved on that M team? So other people that we can think about, just being able to be sure that we are inviting other appropriate personnel who might need to be doing an evaluation for something specific. So if we want to, we have a speech kiddo who we're updating scores on, be sure that we're including that SLP in there. Do we need the occupational therapist? Do we need the physical therapist? What about the multilingual teacher or multilingual assistant who works with our kids? Maybe there's an assistive technology consultant who we would need to consider, or even an autism consultant. Maybe your district has a behavior consultant who might be good. You might have a mental health provider in the building who works with kids who would also be a beneficial member of the team, a school counselor, anyone like that. So team members should know as much as possible about the student. So this is what I mentioned earlier about the role of the multidisciplinary team members. Article 7 lays out pretty nicely what the responsibility of the team is. So the first responsibility is to really review that existing evaluation data on the student. And so here are all the different things that we're going to look at. We're going to look at the evaluations and information provided by the parents. So the parents are going to give us a great piece of information. It tells us how the student is performing within the home setting, which we need to know about because in the school setting, they might be a completely different child. And then some of those pieces of data that you guys mentioned, looking at those state assessments and some of the local assessments. I know iReady was mentioned. NWEA might be something that you also look at. And then some of those current classroom assessments. And so one thing, this is just like a proactive thing to consider. I know from being in many districts that many of them are going to stop using NWEA at the secondary level with the switch to iLearn benchmarks. And I understand, over testing students and all of that. But when it comes to an evaluation and gathering information into something like an NWEA score or iReady data is really valuable and important because it gives us some information about the student that we can compare on a national level. And so we're looking at all kids, who are 12 years old. We're not just looking at a specific set of students, which is what our iLearn benchmarks are really going to look at. And I think we're still all in the process of trying to understand, what exactly is each benchmark measuring and how do other students in the state compare with my students. And so when we think about what Article 7 tells us, that we have to have those local assessment pieces, being sure that we're bringing pieces that have meaning, that we can really put into a broader picture. Like NWEA, when it gives me a percentile, I know what that percentile represents. When it tells me my student is in the 23rd percentile, that means something to me. I know that where that is. I know what kind of score that's going to represent. It's going to be a lower average score. But sometimes when we look at the iLearn data, it might not mean as much. So when our teams come together, it might be important to express to them, we really need this good data. We need some data that is not just opinion, but this really good data. Couldn't be the word I wanted there. But then also those classroom-based observations and observations by teachers and related service providers. So those will be up to the members of the M team. We're going to talk a little bit more about that when we get into the observation piece, but it's up to that team, to collect those observations and to do those observations. So the second thing that Article 7 tells us is a responsibility of that M team is that on the basis of the review from number 1 and input from the students' parents, this is what we're going to look at. We're going to identify that suspected area of disability. And we've got all of that pre-referral data to help support why we want to look at the specific eligibility. And then, of course, any additional data that might be required. So we might look at any related service needs that the student might have as we look at that piece of the evaluation. So when we get ready to give forms to parents, we really need to have those ready to distribute to them when the parent signs that permission. So some forms that we might want to have prepared, the background history, a social development form, different districts call them different things, any rating scales that we might have, and I have rating scales on there twice, behavior scales or adaptive scales, anything else that we might need from the parent. I'm really curious what I meant by that second rating scales. I know in some districts, those are actually sent with the permission. So I'm not sure how you guys do that in your districts, what your procedure is, but hopefully you've got one going for you guys. Also, we need to get any needed release of information forms signed as quickly as we possibly can. And Rebecca says she gives it with permission and parental rights for sure. That's my favorite way of doing it. And that was always what I would do too. Just give it to the parent as a packet or present it to them. The homework packet for mom and dad. I love that. I'm sure kids are very eager to go home and tell their parents that they have some homework to do. So get those releases signed just as quickly as we possibly can, and then consider whether any forms need to be completed through an interpreter or given in another language. So some districts have access to forms in multiple languages. I know the Basque is available in Spanish And there are some others but it seems like Spanish is the main one. But maybe we need to consider having an interpreter so that we can get some results from that. Again, if you, well, not really, again, we haven't mentioned this, but if you do use an interpreter, be sure that you always document that in your report that an interpreter was used through the assessment process of the particular rating scale that you were giving. And it can be read to the parent or completed through an interview. Again, I just like to always note if I use an interpreter or if I have to read the questions to the parent, I always like to just note that they were give the or not the instructions, but the questions were read. So when we look at indicator 11, we're really looking at that timeline piece, being sure that we're following that 50-day timeline, or in that disciplinary case, we have the 20 days. But so these are just some general compliance issues that we might run into, just having all of the required components, being sure, that we have all the speech components and that the SLP has maybe completed an observation if we needed that for looking at like language impairment or something like that. That we've really individualized the evaluation. So that's one thing that, that we can get kind of, I don't want to say in trouble for it. I don't really like that, but as we go through the process of having things reviewed, are we really individualizing our assessments to the student, or are we just doing it because that's what we do for everyone? And we don't really consider the individual differences that students might have. Another piece of consideration is just any sort of cultural or linguistic difference. So we've kind of mentioned that already, but just being sure that the parent has information in language that they know and understand, and really that we look at some of those different cultural pieces, especially as we look at what assessments we might be giving. And then documentation issues. And I'm sure you guys get, you're preaching this to all of your colleagues as well, but really documenting every single thing. I know it can get overwhelming to document every single phone call or every email that you might send or message on Parent Square. But I do encourage you to keep that documentation. Be sure that you have everything uploaded into the system and that all required pieces of the evaluation are being completed. All right, so here's where a couple of you said you were hoping to get some clarification on, and this will be successful if you hear about observations today. So I'm going to talk through observations. And again, just like with everything else, throw your question in the chat. Feel free to unmute and ask it as well. I do not mind being interrupted at all. So I really want to pull from what Article 7 says. And Article 7 defines a systematic observation as an observation that is conducted to measure specific, well-defined behaviors using structured recording procedures. So that's what Article 7 tells us it is. But as we think about completing these systematic observations, it also means in multiple settings and across environments. So really looking at, do we need AM and PM observations? Do we need related arts observations? What about a lunch observation? If our student, the question is being asked, does the student potentially qualify for autism spectrum disorder? Well, I'm going to want a recess evaluation or observation because I want to see the child interacting with peers in a very unstructured setting, and that's going to be recess. So if I'm always going to look at what my question is, so what eligibility area am I looking at, and then that will really drive where some of my systematic observations go. So when you think about who can do an observation, it can be any trained individual of the multidisciplinary team. So as we talked about, in Article 7's criteria and under the roles for the multidisciplinary team, one of them is conducting evaluate or observations on students. So we need to be sure whoever is doing the observation is trained to do that observation specifically. We do have some exceptions for speech impairment. We do have to have an observation by that SLP. So we need to be sure that he or she is the one doing that observation. For language impairment and specific learning disability, the observation can be completed, or observations can be completed by anyone except the classroom teacher. So just being sure that we're paying special attention to those pieces. So we're going to kind of talk about the types of observations required under different eligibility areas. So again, ask your questions, throw them out there. So when we look at a speech impairment, at least one of the observations has to be completed by that SLP. So we are including them on the multidisciplinary team as soon as possible, as soon as we know that speech impairment may be a question, or maybe this kiddo is coming to us already with a speech impairment, then we know that we still need to include that SLP in our M team. And then when we look at language impairment and SLD, the observation of the student needs to be in the student's learning environment of where their performance deficit is, or where is their academic deficit, where is it that they're struggling. That's really where we need to see that observation completed. If the child doesn't have any problems in math and we're looking at a specific learning disability in reading, an observation in math may not quite give us the information that we're wanting. And then we have other observations where we're asking to look at the student across various environments. So here's where we have our ASD, blind, low vision, deaf, blind, developmental delay, multiple disabilities, and other health impairment. Often with most of those, we're also wanting to look at those how the kiddo is transitioning from one, maybe one task to the next task, but even also from one location to another location. How well do they transition? Do they transition with the rest of the class? Or do they need some extra supports? Do they need a soft start into that transition? Or do they need a soft start after the transition? So those are some things that we should keep in mind. I've been in some places, and if you want some examples of some observation forms, I'm more than happy to share those with you. I just wasn't sure, when we looked at creating this training, we didn't know who would want to come to this. Would it be directors? Would it be school psychologists? Would it be diagnosticians? So I feel like I'm just trying to throw lots of different information at you so that I can hopefully hit on something. But I do have some samples of some different observations if you would like them. So in one district that I was in, they took Article 7's guidelines for autism spectrum disorder and created a corporation systematic observation for looking at ASD. So it's really breaking down every different area. And the observation is, basically you're looking at the child, watching the child for however long, you feel like you need to. But then you're just documenting what you observe within each different domain of that. I really like that ASD observation tool. I've found it very helpful. I've been in other places that have really liked it as well. So I've also, with having access to like generative AI, though that can be helpful as well. I have just played around with what sort of observation tools it can create through ChatGPT. I've tried through School Psych AI as well. They tend to be a little bit more restrictive. than something like ChatGPT. And again, never entering student information, but just more of like some of those ideas, like can you create a systematic observation looking at and put in some behaviors? And then I have been really impressed with what ChatGPT has been able to produce as just like that brainstorming tool. And then I could go in and really refine just the specific behaviors that I want to look at. Rebecca, you got it. I'm writing that down right now. So when we think about systematic observations also, I kind of jumped the gun a little bit on that, but we want to look for those behaviors that are commonly associated with the disability or condition suspected. So just like those different areas of ASD that we know that we need to look at, and the behaviors that have been previously observed. So we want to take those into consideration as well. And Sarah, I see your note as well. So for sure, I would love to share those with you guys. So those, I feel like sometimes the ASD observations, it's more of like, well, I know I need this observation, but I don't really know exactly what I should be collecting or what am I looking at or how many different observations do I need? And so I think that sometimes having that form as a like a key is just a really great, gives us things, I know that I'm looking at every area specifically. We've also got, just the simple on task, off task. Okay, so I want to back up here. Someone typed in, I just observed a child with selective mutism and tallied their responses in their initiation of communication with others. Perfect. That's great. And I want to say something more about that, but I think it's on the next slide. But you are providing data, right? So that's one thing that is required when we think about what a systematic observation is. We have this tangible data that we can do something with it. It's not just a feeling or a hunch. On task, off task, those tend to be pretty straightforward. There are a lot of different on task, off task observations that we can use. The Basque student observation schedule, if you have access to that in Q Global, I always really liked that one. It did all the tallying for you, so that was always nice. You're just observing the student every 30 seconds and kind of entering what you're seeing. So that was a great tool to use. And then we really want to look at to see if the behavior is occurring across contexts, or is this something that's only happening in one specific area? So going back to the example that I used with the student who we might be looking at for a reading disability, is that observation in math really worthwhile? Well, that answer could be yes, if the child is almost like a different child in that math setting. That way you're comparing how the child is performing and functioning in that area that we know is difficult for the student, but then how are they performing in that environment where they feel really comfortable and confident? Because we might see two different students. And so that's going to give us a lot of insight. And then as we look at things like ASD, just keeping that observation as systematic as possible to determine, looking at those peer relationships and then looking at those classroom behaviors and expectations. So when we write up our observations, we need to consider clearly identifying at least two separate observations in environments and settings. I know that some eligibility categories under Article 7 only require one observation, and I know our time is so limited, but getting two separate observations is probably more along the lines of best practices. And it's always nice if you get to share the love of observations with someone else so that you're not doing all of them independently. But my recommendation and encouragement is to always get at least two. We want to be sure that we're describing the behaviors specifically. So on task, off task, this is pretty easy for us to do, especially if we're using something that's already been created. We know what behaviors exactly we're looking at. We're looking at, just different areas of academic performance, behavioral performance, adaptive performance. Those lay those out really well. And then going back to the comment about the selective mutism and keeping that tally, that's great because we're including that data. So we have a count, we have a percentage. But really, we have it so that we have some comparison data to make it meaningful. So if we're doing on-task, off-task observation, we want to think about the student, of course, how they're doing, but I always like to use a peer as well. And I would just usually start at the front of the class, and every time I marked an observation mark for my student, I would look at the peer and make a mark for them as well. And that, when I do that, I do it for a couple of reasons. One, I want to see how the child is functioning compared to typical peers. But then also sometimes, I've seen data where the child can't stay in his seat, or she's always blurting out answers. And I go in to do the observation and I'm sitting there thinking, but the whole class is blurting out answers, or the whole class is out of their seat. So I really have that data to say, based on this environment, the child's behavior is or is not different when compared to typical peers. So just for a lot of those types of observations, personally, I always like that data because it brings a different objectivity to the report when we're able to kind of look at our child in comparison. Because, when we're looking at like other health impairment and we're looking specifically at ADHD, we need to know that our child's impulses are greater than what typical peers are, as that's just part of the eligibility that we're looking at. So a question in the chat, what's a good length of time for an observation specifically for ASD? So when I would look for ASD, I would want a minimum of 20 minutes. I would always shoot for around 30, but I would try to do, or not try, I would do those in like the classroom setting, but then I would do one at recess as well. I like to see also a time that's going to include a transition. So oftentimes from like the classroom to recess, or I would set the observation so that I would watch the transition into like a related arts class or something like that. That's where we have to use our judgment because the law doesn't say it has to be this long. If anyone else wants to throw in the chat or unmute and say how long you typically do your observations, specifically the question was for ASD, I would be happy to hear your opinion as well. I just know for my comfort level and wanting to feel like I really did due diligence and I really understood the student, I would want around 30 minutes. And I know that's a whole lot of time, but okay, so that was kind of the wrap up on the observation piece. But before I move on, since there were a few of you who said this was an area where you really wanted information, if you have any questions, please ask those now. I know I just looked at the time, it's 5:05. So I want to move on if we don't have questions. But like I said, I think we don't have a whole lot more slides, but I do want to leave that time for questions. So this next section is going to take a look at compliance issues and individual evaluation practices. So we've kind of talked about those. All right, so when we get to the individual education practices, just being sure that our assessments and other evaluation materials provided and administered in the student's native language or other mode of communication if needed, sign language, do we need assistive technology, what devices do we have? That way we get the most accurate information on what the student knows and can do, not just academically, but developmentally and from that functional perspective as well. So when we really take those parts into consideration, we're really making the overall assessment more individualized for the student. So when we think about individual evaluation practices as it pertains to specific learning disability, really looking at some of those exclusionary factors, Article 7 tells us not to include learning problems that are the result of, and then we have all of these things listed, visual, hearing, or motor disability. So if our student's not passing a vision screening, that's a problem. We don't need to be looking at specific learning disability because we've got to get that problem corrected. If they can't see the material, then they're probably not going to be learning it. If there's an intellectual disability, then of course we're not going to look at SLD. And then we've got emotional disability as an exclusionary factor as well. There are cultural factors. All of these are right from Article 7, and I put the code in there so that if you needed to look it up, you can. And I will be sure that when you are emailed the recording of this and your certificate for professional growth points, that this PowerPoint is included in that so that you have it to refer back to. Other things we need to consider: English language proficiency and lack of appropriate instruction in reading. So when we think about our parents, consider their native language as well and whether or not we'll need an interpreter, and just being sure that we can communicate with them so that they have a full understanding of what is occurring with their child throughout these, the next 50 school days, because it sometimes it can be really scary for parents. Just some general tips: be sure that you're documenting all required evaluation components in that report. It's one thing I really like about this system is that it won't let you finalize that report if you're missing something. Being sure that you have a good note taker during the conference. If it's a conference that might be a little more involved or complex, consider having 2 people take notes so that you can be sure that you capture all of the conversation as accurately as possible. And then any time that you communicate with the parent, be sure that you're documenting those attempts as well. That's going to be really important if it comes 50 days and you're like, we can't get a hold of parent and we can't have this conference. We need to have all of those documented. I would encourage you to, as you communicate, do it by email, do it by phone, a Parent Square, if you have Parent Square or some other school communication tool that you might use. Just be sure that you are using multiple modes of communication and it's not just a bunch of emails. Maybe you get to the point where you have to send that certified letter, but document all of those attempts. So just to stay compliant with indicator 11, just some tips for success: developing that evaluation timeline calendar. And I know that Indiana Department of Education is coming out with some newer and updated guidance. So that'll be released at some point in the near future. So I'm sure I'll be able to update some of these tips once those are released. But really within your district, having that set procedure of, I know what happens from the moment we even suspect that we might need to put a team together for a child, to looking at the data, to who's involved, to who initiates the evaluation, who reaches out to parent. Just being sure that you are really clear about those different procedures. When you have that consent, get that consent out, we need to be considering the conference and discussing when that conference is going to be. Parents need to know that. I ran into it with, it was typically my parents who had like dual citizenship. It's like oh my goodness, we need a conference in 50 days and my mom's in Nigeria. What am I going to do? I can't get a hold of her. But when we let parents know from the moment that consent is considered that this is what the school's looking at, we have to have you available, and really impressing on the parent, you are such an important, valuable member of this team in making these decisions. We need you, we need your input. So give the parents as much notice as possible. Don't be afraid to talk about when that conference might be, but just get it on parents' radar. Develop some sort of tracking system to monitor initial evaluation compliance. Depending on the size of your district, that might be someone in the central office. If you're a small district, that might be you. But what is the protocol? Is everyone following it? And does everyone know how to do it? Maybe it's you, the speech path, and maybe you guys are it. So being sure that you're really concise and that you're both tracking and monitoring those timelines is extremely important. Share the notice of case conference well ahead of time with the parent. You know, like I said, think about that conference and when that might be. Get that out to the parents as soon as possible. Remember, it needs to be a mutually agreed upon time. And then if the parent reschedules, be sure that we're documenting that in the IEP notes, especially if this is like an initial and we're at 50 days and we don't have the ability to determine whether or not a student is going to qualify. We have to put in that documentation that we cannot yet determine eligibility. So be sure to document, and document some more. Okay, so that gets us to the end. And oh goodness, that was a fast time. But a couple of things. The QR code on the left is an evaluation for this training. If you could answer that, fill it out. It's super short, and I can put it in the chat as well if you would like to just open it on a browser. But it's just like 4 to 5 questions, and you can just like click answers. You're welcome to put some open-ended responses in there, as it does give you that opportunity just to help kind of guide this training for the next time that it's offered. Or if you have like some specific request that maybe you weren't able to ask me for whatever reason, or put it in the chat, feel free to put it on that evaluation. And I do get all of those and read them. And I, especially in a training like this, I really use the feedback to guide future trainings because it's always hard when I don't know who my audience is. The QR code on the right just takes you to some of our trainings, but as our school year is winding down, so are some of our trainings, but you can at least explore our website if you would like. We are a free resource for you guys. So as you think about, you know, maybe your district might need some additional support in a particular area. I know someone put in the chat about like FBAs. We offer training on FBAs, and we do get to do that at no cost. And a TA consultant can come to your district. So we have just a job form that you have to fill out that I can send you. It's also on our website that you can fill out and request that technical assistance. We're really here to support you guys as much as we possibly can. And then here is my contact info. Feel free to email me. That number there is my work cell phone. So you can call, you can text. I'm really bad at like turning work off. So if you need a call or text in the evening, don't hesitate. If I'm able, I'm going to get back with you pretty quickly. So now we've got just about 15 minutes left, and I just want to open it up to any questions that you guys might have, to anything that we really didn't get to answer. I know that that was super fast, and I don't feel like I was able to get to everything that you guys said would make today a success. So please, you know, take the time to ask those questions now if you have them. I'm going to stop sharing. Okay, so this is a great question. Can you talk a bit about ED versus ASD and the overlap? I often feel people want ED over ASD. So that is a great question. I have a document that I'm happy to send, and it breaks down ASD on the left, emotional disability on the right, and it talks about where that overlap is and what sorts of characteristics overlap. And then it gives you some guiding questions to look at helping determine which eligibility is more appropriate. And if anyone else wants to jump in, I think this is a question that is asked so often. When we look at that emotional disability piece, we're really concentrating on those 5 areas where we know a student needs to fit for that ED qualification. And then I always like to compare that with the ASD checklist that we have to fill out in the system, because if the student's behaviors are more reflective of what that ASD checklist is asking for, I want to go ASD. But if it's more of things like depression or inappropriate behavior that maybe isn't characteristic of autism, then I might look more at ED. I think also this is where it is so important that you get the parent information, looking at when did characteristics of ASD emerge? What were those characteristics? I like to look at this language piece. When did the child start speaking? When did they start putting sentences together? What's their social communication like, in terms of, we know that communication is going to affect both ASD and ED, but how is it affecting it? So it's just such a comprehensive question. And that's why if you're looking at those, I want multiple observations. I want to see how the kiddo is across multiple settings. Sometimes I've had parents say, well, they're only ED in this particular setting. It's like, okay, maybe it's just the environment, or maybe it's something else that we need to look at, but if you have ASD, you have ASD across every area, every aspect. So really answering some of those questions, any sort of rating scales. I feel like sometimes rating scales like the ASRS and the SCQ, sometimes those are always pretty high. I don't know how you guys feel from your experience, but I just feel like those always show. And Rebecca, I am happy to send you, and I'm writing your name down right now, to send you that document. I think it does a really nice job of explaining. I wish I could remember everything on it off the top of my head, but I can't. And then someone asked about requirement for FBA for conditions such as depression. So this gets tricky, right? Because you can't always see exhibited signs of depression because the child might not be acting out. So again, if anyone has great experience with this, I encourage you to jump in on this. But when it comes to an FBA for depression, I would maybe try to define the behaviors that are characteristic of depression. So can I look at areas of withdrawal? When the student is encouraged to engage with other students in like small group work, really taking a look at those pieces. Are they avoiding social situations altogether? Even looking at things like lunch, what are they doing during that time? I think that those are super hard. And I know some places have even will say depression is more OHI. I believe the way that the law reads, it needs to be emotional disability. But it's just such a hard line sometimes. Sarah, did you have something?
Yeah, I do a lot of those with ED. We get a lot of depression and anxiety here. So like the observation piece is great. A lot of the time for an FBA for that, I would use like triangulation of data using a BASC. If they're self-reporting, I always do a student interview for those as well, and like go through like their appetite, their sleep, what are they reporting with regard to like withdrawal or friends. And a lot of the time when I do those FBAs, I'll define it like they're sleeping or being passive off task, because those are the big depression pieces. And so I'll define it and I'll do like the FBA, but then at the end, I always say that these, like that behavior can be accommodated for, and that we wouldn't need a behavior intervention plan. That's like one of my biggest gripes with emotional disabilities, especially at the high school level, is because I feel like a lot of it is depression or anxiety related. They're not externalizing behaviors. So I had to kind of learn how to work around that in my own way. And like, that's typically what I end up doing is like, I'll do the FBA, but then I say that we can accommodate for the behavior rather than have like a behavior plan in place.
I really appreciate that answer. Like I'm a pre-K, fifth grade, sixth grade. That's where so much of my experience is. And I know what books say and all of that, but it's so much better to have someone who experiences it daily
Yeah,
talk about that.
absolutely. Yeah, fast grading scales are great in student interviews, and then obviously the teachers. So then you've got that and direct observations. Bing.
I love it. Any other questions? And like I said, feel free to reach out to me. I'm so happy to get you information, send it out to you, get you in touch with someone who might be able to better help you on like FBAs and all of that. That's not necessarily my area of specialty, but we have 2 people on staff who train extensively on behavior and functional behavior assessment. So I know that they love going into districts and they'd be happy to jump into you guys as well. So if we don't have any more questions, then I'm going to give you the gift of 7 minutes. But like I said, expect in your email the PowerPoint, your certificate, and a recording. So otherwise, I hope you guys have a great Wednesday and rest up. Thanks, everybody.